When starting an IV, once we have reviewed the physician's order that the patient needs an IV, we then have to find a location, a good vein to start that IV in. So we want to look and see, are there any contraindications? Have they had a prior mastectomy? Do they have a dialysis catheter in that arm, any type of shunt, any other things that would contraindicate us starting an IV in that arm? So once we have determined that there's, nothing, no contraindications, then we can ask the patient their preference, the right arm, left arm, the hand, the forearm, and we also want to make sure of that we're thinking about what the patient's having done. So if someone's coming in and they're going to have their right arm amputated, we definitely don't want to be starting the IV in their right arm. Okay, so once we have determined which arm we want to start looking to find a good IV or to find a good vein to start the IV, we have all our supplies in the room. So we want to make sure that we have our IV start kit. We have our IV needle or IV catheter. We have our extension tubing, our little saline lock here. And then we have our 10 mLs of saline to flush that line. Okay, so we are going to go ahead and look and see what we have in our IV start kit. So we have our tourniquet here. We have our tourniquet. We have our Tegaderm, which we will place over top of the insertion site. We have our ChloraPrep, which we are going to use to clean off that site. And we have two 2x2s. And we also have some tape here that we can use to secure the IV tubing. All right, so once we have gathered all of our supplies here, and we've determined which arm we're going to go ahead and try to start the IV in. I'm going to go ahead and I'm going to tie that tourniquet. And if I'm going to try or attempt to start the IV in this forearm area, then I would want to place the tourniquet 1 to 2 inches above that site. So I'm going to tie that tourniquet here. I'm going to have the patient make a fist, and then I'm going to examine the area, and I'm feeling the vein. Remember, what the vein feels like is going to be much more important than actually what it looks like. So I'm feeling that vein, making sure that it feels viable for that IV. Okay, so I've found the vein that I want to use. And I'm going to go ahead and clean off that site. So for this ChloraPrep, it's a one-step ChloraPrep. So what I want to do is I'm going to squeeze these together, and you'll hear a little pop sound. And once I squeeze that, the medication has now been activated, and I'm actually going to press down on the arm. And for cleansing with the ChloraPrep, they actually have you go back and forth over the area in which you plan to insert the IV. Okay, so I'm going to do that for 30 seconds, 1, 2, 30. And while that is drying, I'm going to release the tourniquet while I prepare my other supplies. Okay, so I have that area drying. I'm then going to go ahead and so I've flushed my tubing, and I'm going to keep that connected and allow it to sit in this little tray so it doesn't become contaminated. So I have that ready. Now I'm going to go ahead and make sure that my IV catheter is ready. Okay, so I'm going to open that up. I want to inspect it prior to inserting it into my patient. So I pull that cap off. I'm looking to make sure the catheter is intact. I see the needle there. And these are called over the needle catheters. And so what does that mean? We literally have a Teflon catheter. You can see that there. Okay, this is a Teflon catheter that is over the needle. Okay, so when I insert this into my patient, we have to have the needle there so we can break through the skin and help guide the catheter. But once I get it to a place where I want it, then I will retract the needle, and the only thing left in the patient is going to be this Teflon catheter here. In real life, we should not be touching this or be touching the end of the catheter, but this is for demonstration purposes only. So again, this is called an over the needle catheter, and all that means is that this catheter is over the needle. Okay, so I have my catheter ready. I'm going to just gently place it back in here, avoiding contamination. And I'm going to grab my tape. I'm going to go ahead and tear a couple pieces of tape and have that prepared. All right, so now at this point, I'm ready to go ahead and retie my tourniquet. I've already wiped off that area. It's dry, so now I'm going to go ahead and insert my catheter. When I am inserting my IV catheter, I want to make sure that I'm not going in at too high of an angle, because if I go in too high, what's going to happen? It's going to poke through the bottom of the vein. So if this is the vein here, and I go in with my catheter at too high of an angle, it's going to poke through the other end. So when we are inserting an IV catheter, you want to start right at about 15-20 degree angle. Once you feel that pop, you know you're in the vein, and then we are going to level off that catheter before we advance it through the vein. Okay, so I've got my area prepared, and I want to make sure that I'm pulling the skin taut or pulling it tight, so we are stabilizing that vein as we're inserting this catheter. Okay, so this is a little difficult to do because it is a mannequin, but what you would want to do, some people prefer to do it this way, and that's fine. I prefer to kind of hold it underneath. So I'm pulling that skin taut, and I'm going to go ahead and I'm going to insert my needle. Okay, I feel that pop, and I'm going to go ahead and I'm going to advance that all the way in. Okay, so I have that in. At this point, I should see blood coming back in this part of the catheter. So I'm going to go ahead, release my tourniquet, and now we're going to pull back and retract that needle. So I'm going to pull back on the sides. You're going to hear a little click. And that comes out. I'm going to sit that there for now. At this point, I'm going to take my extension tubing and I'm going to connect it to the hub of my IV catheter. Then what I want to do is I want to aspirate or pull back, and at this point I should see blood coming back in the tubing. We do not see this because this arm is not connected to blood, but I do see fluid, so I know I'm in the right place. So I'm going to retract that, and then what I'm going to do is I'm going to flush this line, right? And I want to flush the IV site. So at this point, I am making sure in this insertion area here that I do not see any edema. The patient's not complaining of a lot of burning or pain. Okay, so I have flushed the line, made sure that it's patent. I can go ahead and release my flush, and at this point what I want to do is place my Tegaderm. Okay, so this you're going to peel off the back, and what you need to do for this portion of it is you should be covering the entire insertion area up to that colored hub. Okay, so I have that placed, and then you're going to take off this outer covering, following it around. Okay, so I have that placed. And then I'm going to go ahead and I'm going to secure that tubing here. Okay, you can tape it there. This is really up to you, personal choice. You can tape it down here. Okay, and then I want to go ahead and clamp this off. Okay, and then you can use this label here. Okay, so you would write date, time, and initials, and then this little label comes off, and you can place that next to the IV insertion site.